All right, hi everyone. My name is Ashira Vantrees and I'm Athena's sister. And like Angie said, I'm going to be talking about advocacy and public policy with KIF1A and some of the issue areas that we've identified. Like Angie said, I'm a lawyer as my full-time job and I work in health policy, so I work on these issues day in and day out. I'm sure I'm going to talk about some issues that are relevant for you all, but I'm also confident that we're not going to go over everything that you have. So if there's another issue that I haven't raised today that you guys want to get engaged in, just reach out to me. If I'm not working on it, I probably know someone who is. The health policy community is actually very small, so I'm happy to connect you with all of the right people. Okay, so of course I thought it was appropriate to show a million pictures of Athena because I am Athena's sister. So you can see this Athena from a little baby with my mom. We have a big family photo up there in the corner from Athena when she's a little toddler. As you can see from these photos, she's deeply loved and we are all obsessed with how cute she is. I could tell you all about the wonderful things Athena can do, but if there's 3 things I want you to know about her, it's that she's a Taylor Swift fan. She loves getting her hair done and she loves gossip. So although she couldn't be here this year, if she's at the next conference, make sure to tell her all the tea from back home and you guys will immediately be best friends. So just to level set a little bit, and for the global folks, I'm going to be talking about what's happening in the US because that's where I work. But I will have an opportunity at the end for us all to participate in and kind of talk about how we can bring in those global experiences to the US policy conversation. But just to level set, so health insurance is a primary way we get access to care and coverage in the United States. And there's different types of health insurance, and those different types of health insurance are regulated by different parts of the government. So if you have an employer-sponsored health plan, the health insurance that you get through your employer, or if you have Medicare, which is typically insurance for individuals over the age of 65, those 2 types of health plans can only be regulated by federal law. So even if you have a state pass a law that could be really helpful to you, it's not going to apply if you have one of those 2 plans. State Medicaid programs and health plans that are purchased off a state or federal exchange can be regulated by state law. So just to level set, that kind of highlights the importance of us engaging in both state advocacy and federal advocacy. And again, I'm just going to go over kind of what I mean when I say federal advocacy. So if you're from the US, this might be familiar to you. If it's been a while since your high school civics class, this will be a good refresher. If you went to public school like me, you might be learning this for the first time. I'm just kidding. But the US federal government is set up, we have 2 main branches and we call them Congress. And so it's made up of the House of Representatives and the US Senate. Both the House and the Senate have to pass the same bill in order for it to go to the president and be signed. Once a bill is signed by the president, it's considered a law, and then it goes to the federal agencies to interpret how that law is applied. So the most relevant federal agencies for us are most likely the Department of Health and Human Services, the Food and Drug Administration, and the Centers for Medicare and Medicaid Services. So at the state level, it's very similar. State legislators are often more accessible than federal legislators because obviously they're covering a much smaller region and a much smaller set of issues. But state legislators typically are set up similarly. So you're going to have a legislative branch that's often made up of 2 chambers. They're often called the Assembly or the House of Representatives, and they also usually have a Senate. And the process works the same. You have to get the same bill passed in both chambers, and then instead of being sent to the president, it's sent to the governor's office to be signed. And states also have those same agencies who are interpreting what that law says and how it's going to be applied. And so it can seem, I think, really daunting to engage in advocacy at the state or at the federal level. But really, your state legislators and your federal legislators want to hear from you. There was a survey that, or a study that was published by the Congressional Management Foundation not that long ago that found that it only took up to 30 comments on social media for an issue to get in front of a legislator and them to ask questions about it. So it's really a small number, especially if we're thinking federally about how many people are probably contacting their legislators. 30 comments is enough to flag something. And a third of respondents said it was less than 10 comments was enough to flag something. So really, even though it may feel like we're a small organization, by using our collective voices, we can get the issues that are important to us in front of legislators a lot quicker. So thinking about state and federal advocacy, we really have very different points to kind of get engaged and share our perspectives. The first opportunity is when we have a problem and we need a solution. So this is the pre-bill stage in which we're going to our legislators and saying, this is the issue, we need you to introduce legislation to fix it. Once you have a bill sponsor or a bill champion, then you move on to the next phase, which is essentially getting hype around your legislation. So getting more supporters for the bill that you're working on or a regulation. After your bill has been passed by both chambers, the advocacy switch to the executive branch at the state or federal level. So that means focusing on making sure that governors and White Houses are aware of why this issue is important and why the legislation should be signed. The last two are also really important, but they're often overlooked. So the last two focus on regulatory engagement. And regulatory engagement is important because if a bill gets passed and it doesn't have super favorable language, or if there is ambiguous language, you can use that opportunity with the regulators to have that clarification that we need, or have some sort of modification if necessary. So that's kind of like our last opportunity to get change into a bill's enforcement. And then post-implementation is really important as well. One of the things that I see a lot throughout my work is that we pass a lot of really great consumer protection laws, but then they're not utilized, or the enforcement mechanisms aren't used, and so state regulators don't know there's a problem with it. So it's really important, if you think that something has happened and it's inconsistent with the law, that you're engaging those state and federal legislators to make sure that they know whether there's a gap in the law that has to be fixed with a rule or legislation, or if they just need to kind of rein in some of these bad actors we often see. So with that background in mind, when I reached out to Angie and I was like, hey, I want to get us more involved in policy and advocacy, one of the things that we did was kind of break down the different types of opportunities and timelines within kind of KIF 1A that we thought we might be interested in engaging in. So really we tried to walk ourselves through like what that lifespan looks like. And so obviously one of the biggest challenges is getting that diagnosis and that diagnostic journey. The second thing, okay, we said, after you have your diagnosis, then what are you looking for? And so we know it's treatments and therapies, right? And so once you know what the right treatment is and the right therapy is, the next question is that getting covered? You know, are you able to access it from an affordability standpoint? And then the last bucket that we put in here was, it's written as caregiver support, but really it's more of continuing care, because we're not all only looking at caregiving support, but we're also looking at things like challenges in access to transitioning care as children age out of childhood insurance and into adulthood insurance, and things like that. So one of the most important things I think in policy, and specifically for this group, is making sure that our positions and our advocacy is rooted on our lived experiences. And so in order to do that, we sent a survey around to identify what are some of the major problems that people are running into. And really, I think of this slide as like, what are the problems and where are the problems? The where are the problems are really asking the question, like, what type of health plans are we seeing these problems in? Because that informs the type of advocacy we're going to do. So are we going to engage at the state level to fix this issue? Are we going to engage at the federal level? And you can see that the majority of respondents had both public and private insurance. That means they likely had Medicaid and they also had employer-sponsored insurance. And this means for our advocacy that we're going to want to engage both at the state level and the federal, since those private insurance plans can only be regulated by federal law. And then we asked kind of what were the common issues that folks ran into. And so 78% of respondents said prior authorization. And if you're not familiar with the term prior authorization, you're probably more familiar with the practice. And essentially, it's when your health plan requires you to get approval before it will cover an item or a service. You might have also heard of step therapy, and this is when your health plan requires you to try and fail on an alternative treatment before you're allowed access to the originally prescribed treatment. And on step therapy, if there's not certain consumer protection laws in place, this means that you can try and fail on medications that you've already found ineffective. And so this is more of a common practice in epilepsy that we see. So those were kind of the current issues that folks were experiencing and where they were experiencing them. We also wanted to see, be a little bit forward-looking, what would you guys like to see us engage on, even if it's not an issue that maybe is impacting you right now. And I think it's probably no surprise to everyone in this room that a big interest area for everyone is getting more involved in clinical trials and supporting clinical trials, and also expanding access to diagnostic testing, since those are often two big interests of our community. We also surveyed the community to see kind of what other information may be helpful to learn about. And so those are just some other issue areas we're keeping in mind for the future and kind of future opportunities. So as we were figuring out, now that we have the survey, we understand what the problems are and where they are, we wanted to think of our engagement in both of short-term and long-term goals, and not necessarily like we're going to only engage on this issue for 2 years, but what can provide an immediate impact to our families right now. And so for our short-term priorities, we identified prior authorization reform, since 78% of respondents said they ran into a problem with that. And so prior authorization reform often looks at advocacy at the state level and typically looks at legislation that requires health plans to respond to a prior authorization request within a certain time period, and to deem that if they fail to respond to that prior authorization request within that time period, that authorization is automatically granted. We're also seeing a growing trend in state legislation that gives healthcare providers like a gold card status. And essentially what that means is if a healthcare provider submits a request for an item or a service through a prior authorization and they receive approvals, 4 out of 5 times, 5 out of 5 times, that provider then gets a gold card. And so in the future, for any of that item or service that provider has to prescribe, they're no longer required to go through that prior authorization process. So ideally, it's supposed to help reward good providers who understand what insurers are looking for in terms of the prior authorization and help alleviate the administrative burden for providers and also for families from the delays that we know that come with prior auth. In terms of long-term, we wanted to focus on improving interest in clinical trials and opportunities for clinical trials. And that one is a little bit more difficult because it's not just a matter of making sure that that information is accessible. It's more about fostering the environment where there are folks who are interested and invested in researching rare disease treatments. And so we want to make sure that we're protecting the infrastructure that we have in the United States, which I think we've heard from a couple of folks today, how unique it is for us to have that infrastructure and how we do develop a lot of new drugs. And so we want to protect that. So in addition to doing this survey, some of the other things that we did when we're kind of figuring out how to launch our policy and advocacy work is create a web page that can be a resource tool for you all to engage in advocacy on your own. I'm going to go over the web page in a second as well. We also signed on to the Mini Act letter, and our lovely former executive director, Angie, was quoted in the press release from the Congressperson's office. So it's exciting, just bringing, again, more recognition to KIF1A.org. And the Mini Act goes towards that longer priority goal that we have. So the Mini Act clarifies that genetically targeted therapies like ASOs, like the one that Susanna and Sloan are currently trialing, are considered large molecule drugs under the federal Medicare negotiation program for drug pricing. It's really honestly a very technical fix for an issue that doesn't really impact us at the moment, but it's really important because it says that these therapies that are much more complicated to create, they get longer protections before they're subject to negotiation. And so this is just one of the ways that we can kind of help create and foster that environment that says, okay, we want to make it as easy as possible for you to say yes to researching and developing a treatment for rare disease. And so this is just kind of another helping hand with that. And then we also sent a letter to the Vermont governor supporting the step therapy and prior authorization bill that was passed by the legislator and eventually signed by the governor as well. So in 2025, our activities are largely the same, and we're building a little bit as well. So we're still focusing on prior authorization reform. We're still focusing on the Mini Act, which federally. We're also supporting the Accelerating Kids Timely Access to Care Act. So the Accelerating Kids Timely Access to Care Act would make it easier for out-of-state providers to enroll in state Medicaid programs. But the challenge with this law, this bill at the moment, is that it would only allow these out-of-state providers to treat individuals in Medicaid under the age of 21. So if someone is seeing an out-of-state specialist and they turn 22, technically how the law is written, they wouldn't be able to continue to see that healthcare provider. So we've met with the bill sponsor's office and talked to her about kind of this concern that we see, and they are open to amending it, but hopefully we'll get it amended to say that the out-of-state provider will be able to treat anyone under the age of 21 and anyone over the age of 21 with a rare disorder to make sure that we're going to have that continuing access to care, especially as our families grow. And lastly, the Medicaid cuts. So if you watch any of the news, if you're on any sort of social media, you may have seen a lot of information about the Medicaid cuts happening. There have been substantial cuts to the Medicaid program. Most of these cuts won't come into effect until the fall of 2026. So we don't know what the exact impact of these programs are, but we do know that there will be some sort of repercussions. And so what we want to do at the moment is continue to raise awareness that our families who are, many of them dual enrolled in state Medicaid programs, and are individuals living with KAND will likely be lifelong Medicaid beneficiaries. And so the cuts to these programs will have substantial impacts to us. So some of the issues that activities that we've done so far this year is we've met with the MACPAC, which is essentially a federal commission team that's looking into how to improve Medicaid, and they provide recommendations to Congress on that. And so I was able to talk to several of you have already gone through this transition in care after the age of 18. What happens is a lot of your pediatric providers are no longer able to see you, or your health insurance won't cover them anymore because you're no longer a pediatric patient. And so this can happen anywhere between 18 to 22. And so MACPAC is currently looking at better understanding what these transitioning and care issues are so they can provide recommendations to Congress. And so hopefully this report will come out with our perspectives included end of next year or early next year, or end of this year, early next year. Again, like I said, we already met with Congresswoman's office to talk about amending the Accelerating Kids Timely Access to Care to make it more comprehensive for individuals living with rare disorders. We're still supportive of the Mini Act, which has been reintroduced in the House this year, but it doesn't have a Senate companion yet. And then just some other bills that we've signed on to support are ensuring that there's adult changing tables in all federal buildings, especially as we want you guys to get more involved in advocacy. We don't want the lack of restrooms to be a problem. Okay, so this is the website, and I'm going to show you guys the health policy page. So it's under the Get Involved tab. It's like the fourth one down. It says Policy and Advocacy. And this is what it looks like once you click on there. And it has much more details than I've just given you. And I know it feels like I've given you a lot probably. So it breaks down, what are we talking about when we say health policy engagement? What does it mean to engage in advocacy in your personal level, at your local level, all the way up to your federal level? We also have more of the survey results that I went over in terms of how we identified the priorities for the organization, our list of activities, and it also has a section for coalitions we love. We've listed several other kind of rare disease organizations that are also engaging in advocacy. So you guys are welcome to check those out if you have questions about issues that they're engaging on or want to participate with them. Those are always opportunities. And then at the end of the page as well, we have this one pager. And really the goal of this one pager is if you decide to participate in a Hill Day at the state or the federal level, what it does is just help give you kind of some talking points. And so it has some kind of like big picture comments about who are we as an organization, what are our priorities at the state level. This is like obviously only half of the page, but if you scroll down, it also has the federal level. And it has some information about how to share your story and how to be the most effective messenger. So we'll go back to those discussion questions, but I want to talk about our advocacy activity. And I think it ties in perfectly with the theme that we've been talking about today of participation. My mom likes to say that life is a participation sport and you always have to try. This is how she convinced all of my sisters to ride the Tower of Terror at 10 for a Disney pin. It was a mistake. It's not worth the $10 Disney pin, just for anyone who goes. But this is what our advocacy activity is today. So one of the things that's so important is having your legislators hear from you. And so since there's a lot going on right now, federally, we have drafted these letters that summarize that you all were here at the conference today. And then it provides a space for you to share your story. And sharing your story can be really simple. Essentially, it just means telling about what Kifwanewa means to you, telling about why you rely on Medicaid, telling about what the idea of a treatment could mean for you and your family. And then on the back of it, we've already identified what those asks are. So the 3 issues that we're prioritizing is raising awareness about our concerns to the Medicaid cuts, the Accelerating Kids Timely Access to Care, and the amendment that it also helps individuals over the age of 21 if they have a rare disorder diagnosis, and the Mini Act to help, again, foster that environment of innovation that we have here in the U.S. I was going to say something else. Oh, for anyone who's online, if you would like to send a letter, that's my email. Send me an email and I'll send you a copy of the letter and you can fill it out and email it back to me. If you're online as well and you want to participate, please also send me a photo so I can include that in when the letters are sent out. For everyone who's here, I'll be using the group photo that we took. So I just want to kind of reiterate again how important it is to share your story. And it doesn't have to be a big lift, but I think there's kind of two big things that I always think of when I'm trying to do some advocacy through my professional role or my personal role at KIF1A. Whenever you want to share your story, you want to tell them what your problem, tell them your story. Then second, tell them what your problem is. And third, then tell them how to fix it. You know, legislators are always willing to listen to you, but they're much easier to get to act if you tell them exactly what to do. And so that's what the goal of this letter is. So these faces are way more persuasive than mine. So please complete these letters. And while you guys are doing that, I'll open up if there's any questions. Yes.
Thank you. And as a researcher, this is a side of things that I try not to think about, but increasingly more and more in this political climate, I feel forced like, wow, I really do need to do something and get involved. And in particular, it's a issue that you'd mentioned, but I didn't see a specific action item. And other researchers like me are super concerned about the budget that's coming up this fall, and in particular, the NIH funding budget, where we've seen proposal of up to 40% reduction. I mean, that directly impacts how labs like mine will be able to do KIF1A research. And I was wondering, from your expertise, who it is we should be reaching out to and what we should be saying to try to convince our legislators that that's a bad idea.
Yeah, absolutely. So I think, you know, the first people, like you said, your legislators, reach out to them, tell them you're in their district, and that just doesn't mean just your senators. Go to your House of Representatives members. Not only, you know, send them a letter telling them your story, tell them the issue that you're working on. I think it's great if you can partner a researcher with a KIF1A family to really put like a face to the problem you're trying to solve. Sharing that story and what the cuts will do to you is really important. You know, most people I don't think know how impactful NIH is. I didn't even know that one of the programs that was talked about the other day was an NIH funded program. But like highlighting that and highlighting how we wouldn't have that research, which is such a key part in getting to where we want to eventually be with a treatment, is really important. So first, write that letter, see if you can get a meeting. I think letters are great, but also at the end of your letters, have an ask of, I'd love to meet with your office and further talk about this. Almost all legislative offices can now do Zoom meetings because it's just something they've adapted to doing since COVID. So you don't necessarily have to be able to fly to DC to do these meetings anymore. You can also send letters to the Department of Health and Human Services. They obviously have a huge role in deciding what's going to happen to NIH funding. But yeah, definitely start with your House of Representative members and your senators and tell them you want to meet with them. Make them say no to your face that they're going to do these cuts. There was also something, sorry, I wanted to say as well with the letters. If you are not from the US, what would be really helpful would be for us to hear how you guys look to the US system and the type of treatments that you would want to get in your country, but you can't get that are available here. And so, because one of the things that's really challenging in the US at the moment is we're looking to go to much of a more European system and bringing in the drug pricing metrics from Europe. And our just system isn't set up that way. So if you can highlight any experiences where you wanted maybe an expert, but there wasn't one in your country, and so you had to come to the US, or you reached out to US stakeholders, things like that are really important in highlighting the investment that we have in this US infrastructure and figuring out ways to protect it. Yeah.
I just want to reiterate some of your points. I worked for my member of Congress in Pennsylvania for 5 years and then 4 years on the Hill, and subsequently worked for the Every Life Foundation for Rare Diseases. And I can tell you personally that hearing from an individual impacted by disease or one of their loved ones can have such a profound impact. That's how you get a member of staff and also a member of Congress, but also we've seen staff members that who had really connected with a patient or a family. They took that passion the next time in their next office or their next job, and they convinced the new member of Congress that they work for to also be a champion for rare disease. And they just, since it is so rare, they may not have met, you know someone with cancer, but you may not know, you might even know someone with ALS and not connect that it's a rare disease. Also wanted the amazing advocacy and policy page that Ashira spearheaded. The Every Life Foundation for Rare Diseases has some great resources that you can tap into. They even have a virtual youth advocacy day. So if you have a teen warrior or a teen sibling who wants, they do a training. It's all free, and they do virtual Hill meetings. They have Rare across America for to meet in the home office. I can tell you, if you're in DC, first of all, I know it can be really challenging when you have someone with complex medical needs to travel. Members of the House and the Senate, they have offices in your state. And so you can get their attention a lot more when you meet them at home because they don't have the bells going off for voting. So a lot of times you can get one-on-one time with the member and have undivided attention. You don't have to travel to DC, and Every Life can help you make some of those connections, and they have the training available as well. So it's a great. I was so glad that KIF1A is really leveraging some of those coalitions because as the board panel talked about, it's limited bandwidth, and so they're by partnering with coalitions, you can really raise your voices. And also for the researchers, every September there's an amazing rally for medical research. AACR spearheads it. You have members from academic research institutions, cancer centers like Fox Chase, disease organizations, chronic and rare, and also individuals living with rare disease and their loved ones. And you come together as a united front to ask for more money for research. And they already have one-pagers talking about how $1 in NIH funding really is a multiplier within states. So sometimes, first of all, I've done a lot of meetings around research, and I've only had one member say no because he found 10 NIH grants he didn't like. But for the most part, Republicans and Democrats are very receptive. And sometimes that economic argument, when you think about the multiplier factor, when you can come together with an individual being treated at a hospital and a researcher from that hospital and everyone coming together is really powerful. So if you have the ability to get to DC, it's a really, I've attended in the past, it's cool to come together as a community.
Yeah,
in one
definitely.
voice.
I think too, if you're a researcher and you are sending like a letter or something to your congressperson, definitely let us know because there may be someone with KAND who also wants to engage on that issue from your same state or just wants to also share their story or concerns. So we may kind of just be able to send like a follow-up as well, being like, hey, I also heard you've been reached out to researchers. I'm someone who could benefit from this type of research. Here's how it's going to impact me if these cuts go through. So it may not be the easiest to kind of do the exact same letter, but we can kind of follow up on stuff like that.
Do you mind if we take one from online since it seems like maybe a bunch of people have it?
Yeah.
Someone is asking, is this just for Americans?
So this is just for Americans at the moment. If our wonderful international partners, I'm not an international lawyer by any means, but I do know how to research. I can help kind of figure out what that advocacy looks like, but it is at the moment.
I have a question.
Yes.
And I'm going to call out Salima in a good way, in one of the metaphors that she brought up, because I think when it comes to engaging with advocacy, especially for the first time in a country like the United States, it can feel very daunting with our government structure and just all of everything that's happening. And so for me, when I think about advocacy, sometimes it feels like the ladder on the right that you showed, where it's like every rung is way too far for me to reach. But I love now the mindset of, okay, how can we add more rungs? How can we introduce these small little steps to get us to the top of the ladder that we're climbing? And something that I hear a lot about, but I'll admit I don't know a ton about, which I'd love to get your take on, is ways that we can become more locally participating. Do you have any advice on people who are feeling invigorated to advocate and maybe want to start not small in terms of significance, but small in terms of proximity, like looking around their local communities and what they could do there?
Yeah. So I definitely think, for those of you who want to get involved in your community, a great way to do that is through schools, going to your local board of education, asking maybe if you can do a presentation on KAND as a way to educate them and also destigmatize disabilities more generally, talking about what it means to use people first language, what it means to, talk with someone who has an intellectual disability and really just reduce that stigma. I think that's a great way to kind of just get more involved, get your feet wet in advocacy in somewhere that's local and really personal to you as well. Is there another question?
It's not exactly a question, but kind of a comment. Thank you for your presentation. And for the non-American folks here, I want to say it's really been sensitizing for me to realize how much, of course, a lot of what we're doing and talking about is U.S. based, because that's sort of who's here. But it's great to hear about what's going on. But I think one thing that's really important to think about with Medicaid is that often the information we're getting relates to, okay, Medicaid cuts or no Medicaid cuts. And at the state level, a really important thing to know is that at the state level, implementation of Medicaid programs can, whether or not, if Medicaid insurance is cut, there are Medicaid funded programs, particularly as an example, for adults living on their own with disabilities, including KAND, like my daughter. They use Medicaid for non-entitlement programs, like it's not a shoo-in that you're going to get it, but it allows for independent living with people to come into the home for a few hours, whatever's needed, to support a way that people can, with KAND, as adults, can be contributing members of the community. And there's a very strong argument to be made that if that goes away, the alternatives, like living in, once, say, parents are gone, once all of us are not in the picture to be able to support our loved ones, the argument can be made that it is much less expensive to be supporting people living on their own in the community than if they needed to go into skilled nursing care or licensed, any kinds of licensed facilities. And so a lot of times I think people think, oh yeah, Medicaid shouldn't go to people just being able to live in a great situation and go get a coffee with friends all day and go work or whatever. But it's not that simple, and it's not a luxury. There's an economic argument and besides a humane argument. So just, I don't know, to keep that in mind.
Yeah, definitely. I think especially like under this administration for the next 4 years, they're really focused on costs. And so that's going to be a big argument that we want to kind of raise for them, is just the economic cost of these cuts and kind of like the long-term consequences as well. I think that health assessment that's being done in terms of the health economics of it will be super helpful as part of that, because people don't realize what it means to support a loved one who has complex medical needs. And if that person was removed or they don't have those supports anymore, what's going to not only happen to that individual, but also our workforce if that person can't work anymore. And so these are all issues and arguments that we can raise with legislators to make this issue matter on things that matter to them, even though it should matter just because of basic human decency. There was a question on here about what should you do about insurance when you only allowed a limited number of therapies. Definitely appeal that with look at your terms and conditions. There's almost always exceptions within health insurance policies in the US, both public and private, as to when you can get more care than needed. It may be an issue of just providing additional documentation. One of the issues I've been working on at my full-time job is looking at about how many times health plans are denying access to care. And there's this really interesting data from Pennsylvania that shows out of 2 million denials in access to care, only 3,000 were appealed at the first level, and 50% of them were overturned on appeal. So if you do file an appeal, you have a higher chance of getting it approved, and definitely push forward to that secondary appeal if you get denied at the first level. Maybe with additional supplementation, especially for KAND, because we know the importance of kind of maintenance therapies, have that additional information sent to that external reviewer, because you're also more likely, if you haven't prevailed on the internal review, to prevail at least 30% of the time on the external review. So denials aren't really denials, they're just really deterrents.
We've had a couple more come in online. The top one most liked right now is, can you provide specific language on what cuts Congress should not make with respect to KIF 1A? How do we best position legislators to protect our community?
So I don't have specific language at the moment, because what Congress has focused on largely in this last big bill is cuts to providers and kind of secondary and third things that are coming down the line. So I don't have specific language at the moment, but we just want to raise it as an issue. So when an issue pops up, which we know it will at some point in the coming years, they already know that this issue is important to us. But like I said, most of the Medicaid cuts, I think the earliest one comes into effect in the fall of next year. The fall of next year is when we'll really start seeing some of these implications.
And if we don't have another one in the room right away, someone else has asked, how can we use these advocacy techniques to get more researchers to look at KIF1A?
Yeah, I think it comes back to sharing your story, sharing about what the importance of research has done so far. Even if it's just, I think, I can use a personal story that one of the things that we've, I think, wanted to do more for Athena with is improve her vision. And just from the presentation here, now we know that there's additional vision tests that we should be asking for. And I think just that example of showing that exactly what the problem was, how research helped you move forward in a positive way with it, is just a really great example for researchers to continue to move forward with this. I think also showing the prevalence of research in this area at the moment and all the different gaps we still have can help demonstrate that it's an interesting area that probably has a lot of overlap with other conditions as well. And if you can figure out a way to tie it to funding, I'm sure they would love that too.
Any more questions in the room?
Why would they cut Medicaid? Because that's like kind of a slap in our faces.
Yeah, I agree. It's really unfortunate. Unfortunately, a lot of members of Congress didn't listen to their constituents when they said how important these programs are for us and how we rely on them as safety net programs. And so that's really unfortunate. But there in the US, we do have elections coming up next year. So vote with people who help protect your interests and help protect the interests of the people that you love.
Well said, Janie. Ashira, can you explain to the group, like when they talk about Medicaid cuts at the federal level, who actually makes the decisions, like in the states, and how it get cut, and how important is it that you vote local on these issues? Because I think there's some confusion out there. We're thinking we need to call our federal senators only or U.S. congressmen, but it was my understanding that the money comes to the states, and the states are the ones who are going to have some really hard decisions to make. So can you help guide us on that?
Yeah, so basically, just like you said, it trickles down. The governors, your state legislators, they have to figure out how to allocate that money. And so it's super important to also make sure that when you're looking at elections, you're looking at about who's making decisions for you locally. A lot of the state stuff, especially about Medicaid, is the best way to engage. Because your legislators are going to be in your communities a lot more often. Legislative sessions at the state level are often not all year round. So your legislators may only be at the Capitol half the year. The other half of the year, they may be doing another job in your community. And so there's much more opportunity to meet with them. And so they're also going to play a huge role in those decisions. So we're reaching out to your local elected officials in your state houses, your governor's offices. These are all people who can make decisions to protect Medicaid in the way that we need it to be protected. There's obviously there's huge Medicaid cuts coming down, and so something is going to be cut. So we want to make sure that if we're impacted, they're aware of it and figuring out ways to mitigate some of that harm as well. Okay. Well, is there one more question? Good. Okay. Well, I work at Aimed Alliance. You guys can always reach out to me. If you're having a specific problem with your health plan, I'm happy to help you work through the appeal, give you some tips on suggestions, maybe have language that has to be included in there. Just let me know. I'm accessible. If there's more issues you want to engage on, I'm here. Thanks, guys.